Hey everybody, welcome back to the channel again. This is Senior Talking Walks. I am Bill. If you're first joining us, this is actually part 2 from episode 1. Remember, congratulations, you've officially survived the introduction to Medicare. You didn't throw away anything, right? You didn't walk out and you didn't yell at the television. Well, I'd call that a win. So today, we're going to talk about Part A and Part B, the core of Medicare. These are the parts that form the foundation. Everything else in Medicare is a decision that gets built on top of these two things, okay? Think of it like a house. Part A is the roof. It covers your big, major, stay in the hospital type things. That's what Part A does. Part B is the walls and the plumbing, the electrical. This is your everyday doctor visits. It includes checkups as well. So let's keep it really simple, friendly, and real. And remember, I'm not selling you anything. This is just explaining how this works in plain English, which is the way I like to do it. So let's do a quick recap, if you will, from episode 1. Remember, Medicare has 4 key parts. There's Part A through D, A, B, C, and D. Today, we're only going to focus on Parts A and B, or the basics, right? Once you understand these, the rest becomes much easier. So let's start with Part A. All right, what is it? What does it cover? Medicare Part A is mainly hospital insurance. And here's what Part A covers. Obviously, it's the hospital stays. Very important. It's the skilled nursing, the facility care after a hospital stay, some home health services, hospice care. So let's break those down one at a time, but in normal words, okay? This isn't a insurance brochure. It's not going to be insurance brochure words. It's simple stuff. So hospital stays, kind of self-explanatory, right? If you get admitted to the hospital overnight, real admission, you're not just sitting in the emergency room or waiting for a room. You've been admitted. Part A helps pay for the room, the nursing care, all the tests and so on, all those skilled nursing people, the skilled nursing care. This isn't a long-term nursing home living situation. This is a short-term recovery care after a hospital stay, like physical therapy or rehab. A good way to remember this is that Part A helps you get back onto your feet, but it does not pay for you to stay there forever, okay? Now, home health, what does that mean? Well, this is the care at home that's ordered by a doctor because you need help recovering. And then there's hospice. We heard a lot about that. Now, this is the end of the life comfort care. Part A covers it very well. So what does Part A cost? Well, for most people, Part A has no monthly premium. You earned it by paying Medicare taxes through your working years. However, there is a deductible if you're admitted to the hospital. You don't need to memorize the dollar amount. Just know that Part A is usually premium free, but you do pay part of the cost when you use it. So that sounds easy enough, right? So what about Part B? What does it cover? Now, Part B is your medical insurance. This is what covers all of the doctor visits, the specialist visits, the outpatient tests, x-rays, MRIs, blood work, surgeries that don't require overnight stays, outpatient stuff, preventative services like screenings, wellness visits, things like that. That's Part B. So basically, Part B is what you use when you're awake and walking around. If Part A is the hospital bed, then Part B is everything leading up to preventing you from winding up in that hospital bed. So what about cost when it comes to Part B? Unlike Part A, Part B does have a monthly premium. Most people pay the standard amount, but there's a but. If your income is higher, the premium can be higher. If your income is lower, there can be assistance. I'm not going to recite the price chart because they change the numbers every year anyway. You've heard a lot about that. We'll cover how to look it up in the easy way later in this series. The important part is simply that Part B has a monthly cost, and there's also a deductible and some coinsurance. So what does this mean? Well, Medicare pays part, and you pay part. They share the bill like two people splitting lunch, except Medicare tends to leave the tip up to you. So why do we need supplements? What's that? Well, here's the big question. If Part A and Part B are the basics, why do some people buy supplements? Why do you need it? Or Medicare Advantage plans? Well, why do we need to do that? Well, the answer is simple. Original Medicare, Parts A and B, pay a good portion, but not all of it, folks. There are deductibles, there's co-pays, there's no maximum limit or what you could pay in a bad medical year. So the two main paths people choose are, number one, they keep Parts A and B and they add a supplement, which is also called Medigap. And then they add Part D for the drug portion. Or they get Part A and B through Part C, which is the Medicare Advantage. It's the hybrid that has them both. And that's where a private company bundles everything together. Now, don't worry, we'll talk about more of those in episode 3. We're just setting up the picture today. So, example, there's two different people. Let's say we have two friends. First of all, there's Mary. Mary rarely goes to the doctor. Now, Mary wants the lowest monthly cost, but she doesn't mind using a network of doctors. Mary might choose Medicare Advantage, which is Part C. Now, Joe, on the other hand, sees specialists often. He wants the freedom to see any doctor who accepts Medicare. Doesn't want surprise cost. Now, Joe might choose A and B and a supplement and Part D. Neither one is right. They just have different needs. If there's one thing I want to make clear, there is that there's no one size that fits all for Medicare. Your plan should match your health, your finances, and your comfort level. So for today's program, the key takeaway for today is if you remember just this: Part A, hospital care; Part B, doctor and outpatient care. And if you pay some cost, and you will pay some cost for each, that's the entire heart of today's session. You now officially understand, actually more than most new Medicare enrollees. Now, next time in episode 3, we're going to talk about the Medicare Advantage, which is Part C. You've probably heard a lot about that. You've probably seen a lot of commercials, or maybe even getting a lot of calls if you've already checked into it. The prescription drug plans in Part D we're going to cover, and how to choose between Advantage and supplement plans without losing your sanity or throwing the TV remote. So make sure, please, to subscribe if you haven't already. Click that like button so that we can get this information out to a lot of other people that need it. And once again, we thank you guys so much for watching, and I look forward to seeing you in the next episode.